I didn't imagine that I would be teaching on these things 7 years ago, 8 years ago. When I first became a chiropractor, everything was physical. Everything that I looked at was physical. It's if you had some sort of sporting injury, headaches, migraines, shoulder injuries, it all had some sort of physical origin. That's all I really saw. I had several different dimensions of my education, but it was largely very physical. And then as I got into practice, what I was noticing is I kept getting patients that would be cranked through the healthcare system. And what I mean by that is they would show up with a problem, and then they would end up seeing all these practitioners that were hyper specialized and hyper focused in their given field: stomach issue, GI doctor, skin issue, dermatologist, headaches, neuro, back pain, ortho, or neuro. And it seemed like there was this incompleteness that was happening. And what I didn't have a word for at the time is they were practicing something that I have come to know as degenerative medicine. Degenerative medicine falls under this reductionistic category of there is this symptom, there's this destruction, something breaking down, some sort of expression that is dishealth, dis-ease, lack of homeostasis. And we do not care what the root is. We care how we can get the person circumstantially feeling better in the shortest amount of time. And sometimes not even that. Sometimes it is just getting it to look a certain way. Sometimes it's to just tell them to rest and to wait 6 weeks and hopefully it's better. It largely felt incomplete to me. It felt like they were asking, as in patients were asking bigger questions than the doctor had answers for. And it was across the board. And so I got curious. I'm like, what is the miss here? As I think a part of chiropractic, there's this unifying theory of biology of you are meant to be healthy. You have the blueprints for health. Anytime there is dishealth, lack of homeostasis, then there's some sort of block. And we're taught physical, chemical, mental, emotional. And we can ask these questions in this methodical way. And it doesn't have to be reductionistic and just pointing to a singular thing or pointing to a singular symptom, which is very easy. How do you ask the deeper questions in the essence of everything affects everything? It's complex, as in, I can put a needle in the back of your knee and it clears your sinuses. I can put one in your hand and send you into labor. There's all of these processes that happen at the cell, within the nervous system, within the immune system, that are all heavily intertwined, that the specializations are trained to not look at. They're trained in a way to just stay in their lane, even though the body does not work in isolation. Disease works in isolation. So when you have disease, all right, there's several processes that are going to contribute to aging, contribute to disease, dysfunction, and we're going to go over that today. We're going to go over a bunch of breakthrough technology. We're going to go over AI and how you can install it in your practice and have it be a profit center. We are going to talk about these breakthrough detox therapies. We're going to talk about how you can get into cellular regeneration on the higher price, higher ticket, or on the lower ticket. And it requires us coming back to this singular question. Do I want to practice degenerative medicine or regenerative medicine? I do believe that even though regenerative medicine is an emerging field, it's relatively new, unregulated, and anybody can call themselves that, just kind of like functional medicine doctors. Anyone can be a functional medicine doctor if they take a class, or they can proclaim themselves to be that at least. I believe chiropractors were the first regenerative medicine doctors because 100 and something years ago, we were talking about how the body's meant to be healthy and it can heal itself. And through nutrition and essentially unblocking cell luxations, they were able to watch people heal. That was then. It's different now. We did not have as much poison on our food and our water and our air. We weren't as isolated, as in like not having as many social relationships. On average, I think the stat was in the 1960s, the average adult male had 7 friends, 7 good friends that they would call their core inner circle. Now, in the 2000s and 2020s, the latest one is they have 1.5. So Going from 7 to 1.5, call it 1. They have one good friend that they can talk to. So we've become more isolated. We've become more poisoned. We've become more stressed with our phones. We've become more exposed to radiation, EMFs and otherwise, if you want to talk about that. So now, how do you apply this regenerative lens that is not new to new technology? And today we're going to talk about stem cells in the spirit of, because on Tuesday, whatever the date was on Tuesday, in the state of Tennessee, in the state of Tennessee, they're allowing these types of stem cells that have been the most groundbreaking stem cells that I have ever seen, that I've ever studied. I've been researching them for the last couple of years because one of the doctors I love to follow has been using them the last 3 or 4 years. They're called Muse stem cells. So these types of stem cells are very interesting because historically, I mean, you can see tons of different clinics out there do have stem cells in their office. And there's a few different procedures that they can do it. They can have it from Wharton's jelly. They can have it from stem cells from these labs that largely most of them have been closed. There's only been a couple of them that have remained open and stood the test of time as far as regulatory. One of them being Vidi Labs, if you're interested in looking into them. So these new types of stem cells came from a Japanese scientist. She discovered them in like 2008, 2010, largely by accident. She left things in a petri dish in this stem cell medium. Essentially everything dissolved except these specific type of cells. And they became a stress enduring type stem cell. So with that, what makes it delineated from the other ones in the past that apparently are not so good? Historically, stem cells were vulnerable. They did not typically do what we wanted them to do in the body. They didn't have a high circulatory effect. Sometimes they would aggregate in the lungs. Sometimes people would have these adverse immune reactions because you are putting other types of tissue in your body with different types of genetic code. It just wasn't doing the things that we were hoping that they would do in the previous iterations. The most recent being mesenchymal cells. Those are the ones that you're going to hear on Joe Rogan. Their practice in Panama, Mexico. Those were essentially the greatest we had up until these ones. And people were still getting results. Like they can put them directly into the joint that was disrupted, whether the shoulder and the spine, and they would get a favorable result. But there were some other potential other side effects, or it wouldn't get the result that they wanted with the highest degree of affect. These types of Muse cells are interesting because you are running into, that's a good way of saying it. As I understand it, and we are going to be having them at our clinic, as I understand it, one, you're not going to have the adverse reaction from the immune response because when you put them into the body, they come in acting essentially like how the baby acts within the mom's belly. Whether they have a differentiating Rh factor, they're able to essentially be resistant to that genetic code. And then think about how it travels through the body is it essentially acts like a little Pac-Man. If needs to go to the heart, it'll come up to the heart, eat up that heart cell that is damaged, and then actually use the cellular mechanics to essentially regenerate that heart piece that it was aggregating to. You were able to essentially reset the environment of the body. You're turning back time. It's very, very fascinating because there is tons of different applications. And the application that we're primarily going to use it in the office for is for spine, for joints, and intravenous. We do have an aesthetics department. It's a small aesthetics department, and I'm sure a lot of our ladies are going to enjoy because we will do some microneedling with it. They can do some sort of breast lift with it where they actually aggregate the fat into there. We're not going to do that, but there's tons of use cases for these types of cells, and that's what makes them very fascinating. They're stress resistant. They don't aggregate into the lungs. You're less likely to have an immune reaction with them, and you are watching people put them in the spine, put them in extremities, and it essentially resets that process of aging and it pulls all that inflammation out of there, rebuilds the scaffolding of the ligaments, helps with collagen synthesis. Because when you think about it, we talk about resetting the environment a lot. The environment being the terrain within the body. That's why we say move well, eat well, think well, sleep well, drink your water. We're talking about resetting the environment. These stem cells actually facilitate that reset within the immune system, within the nervous system, within the actual organs themselves. You're changing the way that blood flow goes in and out of these joints because of pressure gradients. And one of the things, so we've all heard gut thyroid axis, gut brain axis, gut lung axis, even. But one of the ones that is becoming more popularized now is the gut disc axis, as in like the spinal discs. So I don't know about you guys, every time I shoot an x-ray, so I'm expecting to see the Megan Vloss. I'm expecting to see the air bubble in the gut. It's normal. As I was trained, whenever I see a ton of gas throughout the intestine, specifically the lower intestine, that's inflammation. So a ton of inflammation in the lower intestines, as it was described to me, it means they're not digesting food very effectively. They're just fermenting food. And when you're fermenting food within the gut, you have this nutrient absorption problem. You're not going to absorb the minerals correctly. You're going to change the blood supply within the actual colon itself. You're going to change the permeability of the gut. And what they're finding now is that the gut health, the health of the mucosal layers, the nervous system within the gut, so the enteric nervous system, the serotonin in there, the inflammatory or the presence of a lot or a little inflammatory cytokines within the gut directly affect the spinal disc. And how I portray the language in my office is, hey, when I see a lot of inflammation like this or a lot of gas in the gut like this, I start to change their diet like from day one. As I say, this will affect how quickly I'm able to get you better. So even to the point where when we have people come for intensives, like for an example, we had somebody come down here from Maine for about 5 days. He had a radiculopathy to his left hand, almost lost complete feeling into his hand strength. It was like a glove distribution. He'd been seeing a couple different chiropractors without a result. And then his wife called me and asked if he can come down, what that would look like. And she called me, I believe, the week prior, maybe on like a Tuesday or a Wednesday. I said, okay, starting now, no carbohydrates, remove all grains, breads, even vegetables. I was like, if it's fruit or it walk, swim, flew, or his eggs, he can eat it. Everything else, no go. So I wanted to smash inflammation to the floor. I wanted to reduce even the likelihood of him having some sort of GI irritation before he got to the office, because that's going to, if I only have him for a week, then I'm going to try to move as quickly as I can with the therapies that I can to get him better. So when he flew in, I think on Sunday night, he shows up Monday morning. I see him Monday morning. I see him Monday afternoon. I see him Tuesday morning. We see him Tuesday afternoon. I believe we saw him 2 to 3 times a day, every single day while he was here. And by the time he was leaving on Friday, his hand was near normal, probably 90%. And we did a couple things with the spine. It was mainly an upper thoracic problem. What I find with glove-like distribution like that, global loss and weakness, I'm thinking upper thoracic. It's very rare that a cervical nerve will do that kind of damage. I don't know why. It doesn't really align with what the textbooks are. It aligns with some of the Gonstead notes, which are very interesting. But one of the things that I do for those types of acute injuries, even though it is older technology, it still works very well. And it was before we had access to these Muse cells, is we would use PRP as well, because he was getting a lot of shoulder pain and he was getting a lot of radiculopathy. He'd feel through the bicep and into the hand. And so about midway through the week, we had him do PRP in his shoulder, and it actually helped his shoulder quite a bit. It's just going to go into that repair. I think PRP still has a place for acute injuries like this, whether it's acute joint injuries, which I think a joint injury always has a neuritis component first. If someone injures their ankle, I'm checking their pelvis. If someone injures their shoulder, I'm checking their neck and their upper back. So if they are having some sort of extremity problem, I always check the spine first and then work my way outward. But with that, to try to get them back online, back to play, back to being able to lift their kids, depending on how involved we want to be, I will lean into these more chemical-based therapies, PRP, stem cells, exosomes. And in his case, we use PRP, and it seemed to clear him up quite a bit. So you can do this in your office. If you establish the right pathways and you have the right language and the knowledge base, you are the original regenerative doctor. This is the realm that we play in. It's just now we have more advanced tools, and we have more advanced tools to meet the more advanced onslaught of irritation that we have. So, what are the main reasons why we have cellular aging? It's from stress, from oxidative stress. And so we'll watch the body start to break down. And one of the things that happens as well is you have stem cell exhaustion. So the body is constantly breaking down cells and rebuilding itself, having dysfunctional cells, growing cancerous cells, cleaning it out, as long as we're giving it the things that it needs and doing life affirming things. When we're first born, we have about 200 million stem cells that are in expression. As we get older, that number comes down to about 1 million as we get into our 50s and 60s. So, with that, if we are using these types of therapies, exosomes being the messengers and the less expensive, but stem cells, if we are able to put that into the body on some sort of regimen, maybe it's every year, every few years, depending on the budget, you can start to regenerate these otherwise chronic inflammatory injuries and reverse the effects of time. There are several different factors that are going to go into measuring someone's aging. There's metabolic markers, there's gene markers, as in like the telomeres. But what it comes down to is if I'm putting stem cells into the body and I'm taking these essentially fetal derived stress resistant cells and they're able to go around in the body, they're pluripotent, they're able to be whatever is needed. It can go repair the lung, and go repair my joints. It can even cross the blood-brain barrier. There's even interesting studies with prior stroke patients of them actually getting up out of the chair. It can go regenerate parts of the brain that have been damaged from strokes. So there is an interesting clinic. I've been talking to a clinician that knows him in Mexico, and we've been working on getting some of his protocols at the clinic. And he is, I don't even like saying this like on the public spheres, but he's reversing Parkinson's, he's reversing dementia, he's reversing various forms of cancer, degenerative disc disease, all from these specific protocols, utilizing the Muse cells, peptide therapies, specific gene therapies as well, nutrition. But even in this clinic, in this very advanced clinic with a scientist in there processing these and refining these protocols, the thing they come to first is the biomechanics. They have a physio in there. In our case, it would be a chiro. They have a physio in there that is adjusting their biomechanics first and then actually helping that active element, because we are as healthy as our musculature. If we are losing our musculature at a rapid rate, we're aging rapidly. We're going to change our insulin responses. We're not going to have as many myokines, which help with the immune system for the brain and for the body. If we do not have musculature, if we do not have the proper structure function framing, if we don't have the proper nervous system conduction, what we can do is we can utilize these therapies, which are expensive, and we end up being the highest version of our limited self. So if we're aiming to be the best version of ourselves, as in like I have my thoughts, I have my health span, my lifespan is not just expanding, but my health span, as in like how long I get to live, but how well I get to live. And then another one that they're even measuring now is your sex span. Sex span being how I am aging over time, how is my libido? So your sex drive is directly related to the health of your hormones and also the health of your nervous system, because those hormones only happen within harmonization. Chronic stress states mean it's not time to make babies, it's not time to connect and be emotionally vulnerable. It means I'm go 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 go. But if I am living within an easeful nervous system, if I have a way of coping with inflammation, detoxing effectively, I'm going to have the proper health hormone expression and therefore the proper life expression. And now we can actually measure it. So these clinics are already doing this. The most advanced clinics, I think, in the world are going biomechanics first, and then they are looking at imaging, and then they are creating these advanced protocols utilizing stem cells, exosomes, even PRP for acute injuries. They're using Eboo, they're using NAD, peptides. This is the way of regenerative medicine, and we are the tip of the spear, which is really cool. So the more I've learned about this and the more that I've adopted it into my practice, the better the results that we get and the faster people get. the faster people get better, because you're actually addressing them beyond the system in isolation. If I am acknowledging that there is a gut disc axis and I'm only adjusting the disc, and I'm not taking care of the gut, the chronic inflammatory state within the gut, with it's loaded with IL-6 and it's not allowing the disc to imbibe anymore because it's stealing the little blood supply that the discs do have to try to conserve the gut lining, then I'm going to miss. I'm going to adjust them 40, 50, 60 times, and they may only get a moderate result. Now I get to raise up to be higher than the current practitioners that essentially we are getting patients from, which they're acknowledging that these doctors are only looking at them reductionistic. They're only trying to throw band-aids on bullet holes. But we are doing the same unless we start to add in nutrition, add in supplementation, add in these peptide therapies in a thoughtful way. Because it is easy to just throw all this stuff at people and have it be just a different iteration of Western medicine where you're just throwing things at people and hoping they get better. But there are specific protocols and specific ways you can get people better through this targeted fashion, where now I'm looking physical, chemical, mental, emotional. Does that make sense so far? So when I have patients come in the office, I'll take them through the whole 5-part series. As an example, like I would have women come in that would be like kind of premenopausal, maybe in their late 40s, early 50s. And you can start adjusting them and they would start getting their energy back, their digestion would come back, but I would be tweaking their diet as well. So I never really worked in isolation. But I have this woman, I can talk about her. I mean, even though her case is still open, but so she came in, she came from another medical doctor that was like, quote unquote, like one of the better longevity doctors in Nashville. And she was pretty frustrated. He put her on like estrogen cream and was on testosterone and all these things. And she felt like it wasn't really catered toward her blood work. And she came in, show me your blood work. She's like, I'm on thyroid medications, I'm on this, I'm on that. And now my hair is falling out. I feel energized because I have my testosterone back, but now I'm having all these other funky symptoms, like her joints are getting dry, or like I said, her hair is falling out. She can't sleep. She's hot all the time. She's having this metabolic dysfunction. But the main reason she came in is because she was getting this spontaneous eye and head pressure. She's like, I just feel like there's pressure behind my eyes, and it's like this. And she can touch her eyes and it hurt her a lot, and she would even feel it go down into her tooth, and then when it would go up, it would come from these bottom teeth and then go up into her head. And she'd been doing everything. She did these lymphatic drainage wands, she went and got thermography, and it showed her teeth were lit up. I thought originally, I was like, this has to be like a root canal issue. Did you get root canals? Yes, she got root canals. Okay, let's go to a biological dentist. Let's go get them tested to see if they're infected. Went to a biological dentist over here. They are fine. She needs to get those root canals taken care of. If you're not aware of root canals, they are not the way you want to go. So I was thinking, okay, she has an obvious immune system problem because she's getting all this pressure. She feels like her head is full, her ears won't drain. She also has a nervous system problem because she's getting these headaches. She has pain in her neck. She's having digestive issues. And what she didn't tell me is that her menstrual cycle had been gone for about 8 months. So she thought she was like already in menopause. I was like, okay, great. Like, how I explain it is sometimes we don't need to put a label on it, but we are going to ask bigger questions and start to stack these therapies. So, because some people will want the certainty of, hey, can you tell me what's exactly this? Can you label me, just so I have this ease of mind so I can go on Google or go on AI and start to Google and see what I need to do at home? Because people always, especially high achievers, get into the achieving mode. They don't know how to slow down and let someone help them. They don't know how to slow down and let someone take care of them, at least in the beginning. They do have to help themselves over time. But in the beginning, when you're in this passive phase, it's like, hey, I'm largely doing something to you. You're icing, you're eating well, you're drinking water. And if there's other therapies that we're stacking, then great. But largely in the beginning, I just want you resting, especially with her nervous system because she was so cranked up. So I started adjusting her. We run her blood. Her inflammation's through the roof. Her white blood cells are fine, so she's not fighting off any latent infection that I'm noticing. Her hormones are on the lower but they're not zero. So I don't think she's in menopause. I said, hey, I want to try these peptides, specifically thymus and alpha 1 and BPC 157. So BPC is going to be what reduces inflammation, and it goes to the gut. It can travel around the whole body. It can help joints a little bit. It'll cross the blood-brain barrier and help with brain inflammation, because I'm thinking she has a lot of brain inflammation that's affecting the eyes. One way to describe the eyes and the brain: the eyes are not an extension of the brain. They are the brain. And so in utero, when we are forming, we grow this massive brain, and we have this bone that gets formed around us. And this brain mass keeps growing, growing, growing. And part of that tissue gets forced out through these holes that we call eye sockets. And then that tissue changes to be eyes. So essentially, when I describe eye problems, whether it's bouncing eyes, losing of smooth pursuit, vertigo, in her case, it's pressure behind the eyes. I say your eyes are not an extension of your brain. They are your brain. If you're having eye issues, you have brain inflammation. And it makes people take it a little bit seriously. Obviously, it's truthful, and it's meant to reinforce that what they have going on is very real, and we need to take it seriously. So I give her the BPC. That helps her headaches probably about 50%. And I give her that thymus and alpha 1. Thymus and alpha 1 is meant to help with immune mediated responses, because I'm feeling that she does have some sort of immune dysfunction. She's having skin issues as well, less important for the case. So I started adjusting her, mainly sympathetics. I stayed in the sympathetic area. So when you have this autoimmune expression, complex system involvement, it's usually sympathetics. And so I stayed there. She was seeing another chiropractor that was just doing diversified and I think activator. So she was kind of stimulating everything and not really getting a result. So I adjust her one time, give her the peptides, and I said, okay, great. We're going to run through these peptides while I adjust you about twice a week. And then at the end of you doing these peptides, I want to do some Eboo. And she was fine with it. So about 2 weeks in, she said she starts getting really crampy. Like her uterus gets really crampy. Her headaches are about 50% gone. She's not getting the tooth pain. And like, it almost seemed like trigeminal neuralgia that she was getting, but it wasn't, because it wasn't intense enough. So she starts getting cramping. Her headaches start going away. The tooth is fine. And now her energy is starting to come back. And this is without her being compliant with changing her food. I was trying to get her to change her food and just say, hey, I really want you to do animal-based diet. You can eat fruit, you can do things here and there, but she was just like, nope, I need my sugar. Like, I'm not going to do it. She's a relatively thinner woman as well. She's not out of shape. No obvious metabolic dysfunction, but we didn't do a CGM or a DEX on her, so I don't know what her visceral fat is or her metabolic handling. But we get about 3 weeks in now. It was a week after she tells me she has a cramping, and she gets her menstrual cycle back. This is after not having it for about 8 months. And so she comes in and she's like, I'm mad at you. I got my period back, and burr, 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 burr. And she was just letting me have it kind of in a joking way. But and I looked at her, I was like, that's great. And you can tell she was not real happy about the result. And I was like, well, think of it this way. Everything in life happens in cycles. If you are sterilizing your hormones, if they have gone flat, then we are not essentially in the life affirming cycle anymore. We've reached into that next iteration. We want you to continue to have these hormonal fluctuations. And another one she said too, she's like, I'm feeling real angry and real testy and blah, 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 blah. And I'm like, well, that's fantastic. And again, she just looked at me and like she was not enthused. But again, I always go back to maybe about 2 days a month, do women's hormones find stability? They are meant to be up and down and in the flow of life. So if we have stagnation with the hormones, either from birth control or from an IUD or from menopause, I'm not saying premenopause and menopause are bad. I'm just saying you're still in the flow of life, in the fertility of life, as opposed to crossing over to the next bridge. So being able to communicate with them effectively about that, like changing the perspective, even though circumstantially things feel a little uncomfortable or they're a little upset about the circumstances, showing that they are moving in the direction of harmony and ease is going to be you. Like if their excitement and their anticipation is here, how do we keep you here? Pulling them up. We don't want to be up here because that's kind of annoying, and you don't want to be down here because you will suck people into your depression. So you have to be just a couple notches above their level of enjoyment, their level of excitement, their level of gratitude, and then also be educating constantly on what is life affirming versus what is non-life affirming. To me, that is what regenerative medicine is. It's how do I do more life affirming things than the non-life affirming stimuli that I am being exposed to? And if we think of it this way, and this is the mechanical aspect. This is where I got that visual model of every single thing we're doing every single day is either putting us into tension or taking us out of tension. Everything we do every single day is either putting us into life affirming positions and states or non life affirming positions and states. Every single interaction you have with another human being is either relationship building or relationship breaking. There is no net zero in nature. There is no net zero in anything. So the goal would be, how do you get them stacking therapies in your office? How do you get them stacking habits at home? How do you get them stacking the way that they engage in relationships? As in, the only relationship you can really help them with is a relationship with themselves, because a lot of times they have a skewed perspective on themselves and whether or not they can be healthy. But I do believe that the mental emotional aspect, I've never said it this way, is you are able to help them on the mental and emotional plane by changing their perspective of their own health and their own capabilities. If you can help them see that they have more agency, if you can help them see that they can have some gratitude even when there is pain, you can help them see that there is always hope, then you're going to have a patient, one, forever, and two, you're going to have a patient that actually gets better because they're going to have an expanded will to do the things that would make them healthy. Because there's a reason why they're not healthy. There's a reason why they're injured. Like we said, we don't get injured, we do injured. We don't get sick, we do sick. And you are teaching them through what you say, who you are, what you do, how to be healthy. Yeah. Talk about AI, using AI in your practice. So it's probably about October, probably September, I think September or October. I was trying to figure out, because as I've been growing my practice and there's more practitioners in there, we're opening another location. I had to do things that I had to hire people and not rely on myself, so more at least rely on my hands. How do I build a practice thoughtfully that is wider in its affect, as in, like, I don't need to have my adjusting hands on everybody? And how do I ensure quality assurance? How do I ensure that we're still getting Google reviews that are 5 out of 5? How do I ensure that we're still getting referrals that are like raving fan referrals? And those are the patients we want to see. And then one of the things I thought about is, okay, we've been in the same practice for 5+ years. We have a patient base of like, I don't know, like 3,500 or 4,000 names. And you have some people that fall off and they move away and they're going to get caught up with kids, or they only come for like a short time just because that's just how their mind is. It's more of a reactive mind. So I wanted to tap into these organic ways that I built my practice. It was asking people for referrals when they had a good result. It was asking them for Google reviews, because I mean, everyone checks Google reviews before they do anything now. It just helps your SEO. And one of the things I'd always have my front desk girl do is, if we hadn't seen anybody in the last 60 to 90 days, we would call them. So, hey, Cindy, we haven't seen you in the last couple months. We've been thinking about you. Is there any way that we can serve you right now? Like something super like simple. It doesn't need to be like, come back in for a half off adjustment. I think it's super corny. But if I can figure out a way to leverage these 3 avenues beyond my physical work doing that, and I can make sure that we're still providing an excellent service, what would that look like? And so I got curious. And with the advent of essentially AI being mainstream, I was like, I bet there's a way that I can use AI automation for this. I bet that there's a way that I can build either an agent or some sort of model that I can integrate into my EHR that is able to engage my patients to make sure that we're doing a good job, to ask them for reviews and incentivize that, to ask them for referrals and incentivize that, and then also reach back out to patients that haven't been in a while, all on automatic. So I started digging and I started doing some research. And I was like, does this already exist? And some of them existed. There's some of them like review requests existed, would like automatically prompt them after they left. Hey, can you leave us a 5 out of 5? I'm sure you've been to a dentist like that or some sort of practitioner, but it wasn't personalized enough. I started digging and I found these guys, and they were doing a little kind of that just in the gym space. And so I got with them and I started making this model, and then I plugged it into my office. And so now essentially the client journey as they go through anything in our office is they call into the office. Hey, I'm a referral from so and so. Hey, I'd love to take care of you. What days work for you? Mondays or Tuesdays, morning or afternoon? Okay, 10 or 11. Okay, 10. Do you know where we're located at? Great. Healing starts at hello. I believe our clinics are meant to be an immersive experience where they finally trigger a part of their brain where they think like this is where I draw a line in the sand, where the previous non-healthy me is not coming out of here. So we want as many checks and as many influences on the unconscious mind, emotional engagement to signal them that this is the end of one chapter and the start of a new chapter. So they have the office tour, they sit and wait, I come get them, or whoever the practitioner is that comes to get them, history, exam, x-ray, report of findings, adjust. On their way out, they pay. We're an all cash office, so they're paying with card cash. Okay, great. When does he want to see you again? Tomorrow, Wednesday, whatever. When they check out, now we have an agent that automatically sends them a thing. Hey, Cindy, thank you so much for visiting us today. Would you mind taking a second and rating us on a scale of 1 to 5? And if they rate us on a 1 to a 4, I get a message, and my virtual assistant gets a message saying like, "Hey, something happened. There was a miss. We need to go engage a conversation. Maybe there was a miscommunication. Maybe there was an expectation that wasn't met. Maybe we missed something in some sort of process." So this is for all the practitioners. So I get to see exactly in real time how everyone's performing, including myself. If they rate us on a 5, we know that they're a brand champion. They're super excited for their visit. They feel like they were cared for and that things were different. And it's going to say, "Great, Cindy, we're so glad you had a great experience with us. Would you mind leaving us a Google review?" And it'll pop the link up and it'll say, "If you leave us a Google review, you get X incentive." I think we raffle off a membership like a couple times a quarter. So they enter to win something. So they go on, they leave a review, and then we will get the ping automatically. Like, "Hey, Cindy left us a review. Amazing." And I have another AI agent that responds to that review. So, by the way, if people are leaving you reviews and you're not responding, it dings your SEO. And then actually, patients that look at your Google reviews and see that people are saying nice things about you and you don't say anything back, that's not as reflected as nicely. So people are missing that element of SEO and that element of rapport building. So we have an agent that automatically does it. "Cindy, thank you so much. We're so glad you had an amazing result with connection," yada, yada, yada. The next day, knowing that Cindy was a brand champion, she left us a Google review. She's very happy with her results so far. It's going to automatically prompt them. Another agent will send them a message and say, "Hey, Cindy," gosh, I don't even know. It's a custom message. Essentially like, "Providing excellent service is how we grow the practice and how we serve at a high level and how we contribute more good to the community. Who do you know that you would like to give a $100 credit to?" Or I think it's a $200 credit. "Who do you know that you can give a $200 credit to?" And then they're going to type in their name and their phone number, and then that person will be automatically sent a text from the agent again saying, "Hey, Janice, Cindy told us like you'd be interested in coming to the office. Here is a $200 credit. We've already put it onto your account. All you have to do is make an appointment." So all of this happens without me touching anything. It's bananas. So now we've done quality assurance. We've gotten a review. We've reacted to that review and helped our SEO. We've gotten a referral. We've engaged the referral and given them essentially this warm introduction of like, here's your $200 credit. We already put it in your account. And I think we even put a time limit on it. Like you got to use it in the next 3 weeks or something like that. So we create urgency around it. So now we're going to get a new patient out of it from this new patient that's just been excited about our services because we are doing a good job. And that is how we're going to continue to grow the practice. And so now Janice comes in, and then Janice has a great result. And then she's going to bring her husband in, Tim. And it just grows from there, all from automation, which is really cool. You can't take the human element out of it. We still have to provide excellent service. Like that is the mandatory part. You have to be good at what you do. You have to have good hand skills, communicate effectively. You have to be able to sell, which guess what? Everything is sales. Even if you don't want it to be, everything is sales. And then you get the privilege to be able to ask them for those things. I would always tell doctors, I've told this for 10, 12 years, you don't have the privilege to teach them chiropractic yet. That's an old Gonstead quote. You got to get the result first. Get the result, then teach them what you do. Teach them what their problem is, but then really just care about who they want to be, care about their vision of their life so much, care about them so much that they get inspired to move into action. When they get inspired to move into action, you provide a result, then you get the privilege to talk about what you are and who you are. If you ever want to kill authority, talk about yourself. If you want to kill authority, talk about yourself really early or smile too much. So all this happens on automation. We did a good job. Yay. And then on the back half, so something completely separate, is we have this AI agent that it's monitoring our records. It's reached directly into our EHR and it says like, okay, trigger. Hey, Ryan hasn't been in the last 90 days. We're going to send him a message. Hey, Ryan, we're thinking about you. Why don't you just shoot us a message? Let us know everything's okay. And if there's anything we can do to assist you with your health care, please keep us in mind. And then it can be, I don't know, we haven't seen Jim in 6 months. Hey, Jim, it's getting close to the holidays. We know with the hustle of the holidays, like everyone gets busy, wrapped up traveling. Make sure you're taking care of your immune system. We're thinking about you. If you need anything, let us know. So this all happens on automatic. So we're able to reactivate patients that haven't been in a while just because they forgot or they got busy or they had more kids and they get wrapped up. Sometimes they move and they let you know. And then now we know, we check them in the database. Hey, they moved to Arizona. Hey, they moved to New Mexico, and it's fine. But it just is it's a rapport building thing because now it's like, hey, they cared enough about me to check in on me. And we're not soliciting them anything. We're not, like I said, we're not saying like, hey, come in, get your half off adjustment and free vitamin D injection. Kind of cheesy. I ignore those. I don't know about you guys. I ignore those. Anytime I get a hint that it's an AI thing, an AI agent, I don't like it. But if it sounds human, I don't mind it. Or it must announce itself that it's AI. I don't mind that either, because if I answer the phone, I call a business and it's like, hey, I'm the AI agent for ABC Fitness. I can answer any questions for you, or I can get a service ticket. What can I help you with? Like, I don't mind that. But if it's an AI agent that's trying to act like a human, distrust immediately to the business, virtually across the board for anybody, which is funny because probably AI is going to do most of our jobs much, much better. It already does most of our jobs better now as far as aggregating data. It's just we as humans have a high distrust for it. What's funny is apparently the autopilot on planes has safer statistics than the actual human pilots, but we prefer human error over the possibility of a small computer error. So that'll be some of the growing pains that happens over the next subsequent decades of if we're going to have humanoid robots and AI everything, and everything's going to be integrated into these smart cities, which I'm pretty sure it's going to come, and it's going to exterminate a lot of professions. I think some of the first ones within healthcare are going to be direct primary care, surgeons, I think might be one of the first ones because robots will do it, and then pharmacists. Pharmacists right now are already ATMs. So those three, I think we're going to be cooked soon. And right now in Germany, they have full factory assembly of these phlebotomy bots that it literally pulls up. It's like a hood, it pulls up, puts it over your arm, then it punctures, draws the blood. So the person never sees it. There's even a little anesthetic that's sprayed, so they don't feel it. They don't see the blood. There's no human messing up and messing your veins. And it's ultrasound and thermic guided, so it never misses or very rarely misses. Nurses are cooked. So The thing we want to retain, the thing we want to promote within our practice is that we stack these systems. We have physical care, chemical care, mental emotional care. We know how to communicate effectively with these patients. We're not swapping out the human element, but we are accepting the technology that is going to advance our practices forward and that is going to advance our results forward. So, and if you guys are interested in that at all, if you guys are interested in the AI agent stuff, just let me know, shoot me a message and we can talk about it. But I've installed it in a lot of practices and it works really well. You guys hear me talk about the mind a lot. You guys hear me talk about how you need to influence behavior, the unconscious mind, and then we get the privilege to actually help them. People don't make decisions with their logic mind as much as they think they do. People make emotional decisions that validate their identity and they backfill with logic. I'll say it again. People make emotional decisions that are based on their identity, their self image, who they think they are, which is largely programmed before the age of 7 and 9. And then they backfill with logic. I'm just not that person. I don't make decisions quickly. I don't take risk. I'm just not meant to, blah, blah. These are my headaches. This is my thyroid issue. I'm just this body weight. Like, people will continually use logical frameworks to validate an emotional constipation, is a way of saying it. Reason being is, so when you break down the mind, I want you to think of a pyramid. And at the very top, so think of this as levels to your psyche. And this is just how I think of it. I have no science to point to exactly. This is from a collection of works. It's from Carl Jung's work and from what's his name from Psycho-Cybernetics. What's his name? Bob Proctor's work with the stick man. So we are going to start at the top. And depending on the level of irritation, depending on the level of impact of the emotional weight or the emotional trauma, I don't want to use that word, but the emotional stimuli will depend on the amount of influence will be required to help that person. I'm not saying you do all of it, but I want you to get good at seeing this. So at the level one, at the highest level, you have thoughts. Thoughts are electric. You are never going to convince anybody of anything trying to go thought to thought. What does that look like? You try to explain something to somebody in a logical framework. You try to logic somebody out of their emotional problem. Doesn't work. Thoughts happen in real time. And if someone, let's just imagine someone gets some sort of electrical irritation, it's like someone cutting you off in traffic. Like, kind of pisses you off for a little bit, but you can reframe like, oh, maybe they got to get to work, maybe they got to pick up their kid, maybe their wife's in labor. I don't know. So it's a quick perspective change. It only lasts like a second. Then you have feelings. Feelings happen after thoughts cue them up. So these are real time. These are in the moment. And then the opposite of these being emotions. Emotions or feelings collapse in the illusion of time. So emotions, I can think of something in the future that makes me excited, and I can feel excited. I can think of something in the past that pisses me off. They are not real time. So they're collapsed in the illusion of time, collapse with separation, and can be evoking of positive or negative associations. The next thing we have are beliefs. Beliefs, what are they? They are thoughts you keep having. And these could be limiting beliefs about your health. These could be positive beliefs about wealth. These could be people are fundamentally good. That's some sort of belief. It could be religious beliefs, but I think that's actually deeper. Beliefs are just thoughts you keep rehearsing that feel familiar, and they're life affirming and some are non-life affirming. The next thing we're going to have is patterns. Patterns are habits. So both are the same thing. Habits are just things you do on autopilot. You largely don't think about them. They define a lot of who you are because most of our days are patterned, repeated, rehearsed responses and routines. So your patterns define at a deep level who you are. And how we can describe this is The reason why, and if you didn't know this, moving cross country or even moving states as an adult registers very high on the stress scale, or the trauma scale is how they describe it to me, but I think it's just a stress scale. It's like number 3 or 4, next to like death of a spouse or one other thing. So when you have disruptive things, radically disruptive things happening to your patterns, that changes your psyche quite a bit. That's why people feel like their head is spinning for a while after they move, even if they have a core value of adventure and you are disrupting people's patterns when you are opting them in on a health journey. That's why a health journey can be one of the most intimidating things for people for multiple reasons. But one, you're going to be destabilizing their habit. Two, if part of their core identity is they only ever get attention from when people feel pity for them or help them, and the idea of them not getting that attention or that help because they're an empowered individual can go away, they may not want that. So you being able to read like, hey, does this person have some sort of core need of like pity, or this is the only way that they can suck energy out of people, which that is a real thing, then you're going to notice some roadblocks and them wanting to do the things that help them get better. All right. The next one is paradigms. Paradigms are interesting. They are clusters of behaviors and beliefs that are automatic. So they live in your brainstem. An example of this would be how much do you need to think when you see blue lights flashing behind you when you're driving? Probably not much, right? And you don't need to think at all because that's in your spinal cord. That's in a reflexive response to freak out, to have a stress response that like, oh shit, am I getting pulled over right now? So that type of stimuli, and there are tons of different stimuli that are just laying in the unconscious mind. They're not things that you're conscious of how people change their tone, how you earn money, how you spend your time, whether or not you're meant to be healthy or not, where energy comes from, as in like your vital energy, all live subcortically, live in the spinal cord. So when you are dealing with paradigms, those are the things that are going to limit people. You can have beliefs be limiting, you can be patterns limiting, as in their routines are poor, but paradigms, you will run into something called upper limit behaviors. Gay Hendricks talks about this a lot with his book called The Big Leap. Highly recommend it. His quote is, the only thing worth solving is your upper limit behavior. And he spends a whole book on basically we have these behaviors because we have a physiological set point of how good we allow ourselves to feel, how much love we let in, how much creativity we have. All of these limits exist in the pardon me, all these limits exist in the unconscious mind. As an example, it would be like, hey, I'm having this beautiful night with my wife, and then all of a sudden I start having these scarcity thoughts of like, well I'm not working right now, so how am I going to pay the bills and blah, 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 blah. So, or we're having a beautiful night and you pick a fight with somebody. So that stuff happens. It's because our psyche is a psycho-cybernetic unit. And what that is, according to Maxwell Maltz, is it's like your air conditioning unit in your home. You set it to 78 or you set it to 70. Then, if it gets too hot, the air conditioning turns on. If it gets too cold, the heater turns on. It's meant to keep you at this set point. So, paradigms are that set point. And breaking those set points require radical action and usually you leaning into scary stuff or you leaning into the uncomfortable, moving out of the familiar so that you can go be somebody else. You are helping them be somebody else. And that can be through the investment they make through therapies, that can be through them eating differently, that can be through them actually using chiropractic or stem cells or something else. You're changing their paradigm on health with the things that you're going to be doing. So remember, you're breaking their upper limit patterns. You are helping them be something greater and expect resistance. If you want more on that, read Maxwell Maltz's book, Psycho-Cybernetics, or you can read The Big Leap. Both are great books. I think both are fundamental in working on yourself. And I do think running a business and being a parent are the only two things that require you to become a better human in order for them to work smoothly. No amount of tactics or parenting coaching are going to make your business or your parenting easier. It's you literally just becoming something else. And then the last one, which we kind of touched on this whole time, is your self-image. Your self-image is the core of who you are, how you see yourself, as in, do you see yourself as someone of value, that's someone that has something to contribute, that people are excited to see, that you're attractive, that you are a wealth magnet or not. Your self-image is the core of who you are and how you make all of your decisions. Why did I take all this time to unpack this? It's because depending on the depth of how someone was affected will depend on the depth of influence you will need to help them get better. Someone having an irritation at the thought level needs way less help than someone on the paradigm level. If someone has a paradigm of like, I can only be helped eat and restricting my food reminds me of my dad and like having these constraints that I'm going to rebel, that's a big paradigm. So at these top levels, I would even say like talk therapy could be something you recommend. But when you get to these lower ones, if you ever want a terrible statistic, you know how many, in order to have a statistical significance on someone's emotional state, just using talk therapy, do you know what the average amount of visits it needs? Somewhere between 70 and 90. And that's to get a 8 to 11% improvement in someone's emotional state. Is that me saying that talk therapy doesn't work? No. Is me saying that there are things that we are missing with just talk therapy alone, because again, it's in you're operating in isolation. You're not engaging the body, you're not engaging the chemistry, you're not engaging archetypes, which is very interesting. We can talk about storytelling. So if I am just going thought to thought, electric to electric, or a little bit of chemical to electric, then it's a very weak stimuli, because guess what? People run out of willpower, they run out of motivation, they run out of guilt. If you're trying to guilt them into change something, people run out of that. It must be this radical self-image change where they actually see themselves as something greater and then they go get it. And that can be just how you architect your language and just be like, hey, where do you want to go, Cindy? Let me help you get there. But you got to emotionally connect to that. At these bottom level ones, there is an interesting study where I think Joe Dispenza talks about it a lot. You cannot fix your problems in the same brainwave state that got you there. And thinking about your problems in the same brainwave state that got you there actually will make your brain metabolically worse. As in, like, thinking about your problems in high wave beta, so a high stressed response, makes your brain age faster. The goal would be, how do I change someone's brainwave state? How do I move their body into action, which is cool because we're adjusting them actually does that. So now I'm changing their brainwave state, I'm changing their perspective, I'm changing their chemistry, and then now I'm helping them to see a story of themselves being greater. You can architect all of this in your office just by having the philosophy of healing starts at hello, because you're architecting this entire time the story of them being the greater version of themselves and that you're going to help them get there. And you're essentially writing, to use Chase Hughes' words, you're becoming the narrator for the next scene in their story. And if you're becoming the narrator for the next scene in their story where they actually want to walk into that next scene, that's powerful. And you're creating the community and you're creating the container that actually helps them move into that new state in a healthy way, while compounding that you're helping them with their chemistry and you're helping them with their nervous system. That's what I mean by helping someone mentally, emotionally. So you're creating a container, you're becoming the narrator for their next scene in their movie, and then you are walking them through this next iteration. It takes practice, but you can do it. And that's that orchestrated, unified. So it's the orchestrated, unified intention of your whole office, that you are meant to serve these patients and help them become something greater, not just making adjustments and not just collecting revenue. It's like you are watching someone come in one state and they leave in another. And that's what you keep reinforcing over and over again. And that's what we talk about in the office. So with these lower ones, beliefs, patterns, paradigms, self-image that largely live in the unconscious, this requires brain wave states, chem plus story. And we can spend several hours on storytelling. But if we can just get this down, and again, we need the chiro, biomechanics first, breakthrough therapies next, as in stem cells, exosomes, peptides, Eboo, and how those stack together. And then the skin of everything that keeps it together is the ecosystem within your office and how you communicate about where they can go with you, and also how they can actually heal beyond the confines of what they've been told, because you are undoing a lot of brainwashing that these people have been under. They've largely been marketed to and saying you need these drugs, you can eat this way, and or that food doesn't even matter. And then from there, now you're saying food matters, your habits can change, you can be a better individual, you are divinely supported by something greater than yourself and by us, and you matter. When you stack all of those together, that's how you transform a human, and that's how you transform an office.